I'm Dr. Arnie Vainio, and today we're talking about COPD. COPD, or chronic obstructive pulmonary disease, prevents with chronic shortness of breath, wheezing, cough, and sputum production, and is usually caused by cigarette smoking. COPD tends to get worse over time and is not fully reversible. COPD includes emphysema and chronic bronchitis. Lung diseases can be restrictive, which makes it hard to inhale, or obstructive, which makes it hard to exhale all air out of the lungs. Sometimes people with COPD get what we call exacerbations that can be mild or downright life-threatening. Suddenly the symptoms get much worse. This can be triggered by a variety of things, such as bacterial or viral illnesses, temperature and humidity extremes, or air pollution. Exacerbations can be scary because breathing becomes more difficult all of a sudden, and they can become more frequent as COPD progresses. What's worse is that the exacerbations themselves can make the underlying COPD worse. Diagnosing COPD can be difficult, and we need tests to rule out other diseases. These tests include pulmonary function testing, chest x-rays, oximetry, which is oxygen level testing, CT scans, and arterial blood gas testing. Not all tests are necessary in every case, and sometimes additional testing may be needed depending on test results. Treatments include bronchodilators, which are medicines to help open narrowed breathing passages. We also may prescribe steroids taken by mouth or inhaled. Steroids work to decrease inflammation and sometimes need to be given by injection if people are really sick. Steroids have lots of side effects and can raise blood sugars, decrease immune system function, and can make people really crabby and hungry. Antibiotics are often prescribed, especially if an exacerbation is caused by bacteria. Some folks with severe COPD need to be on oxygen to survive, and oxygen can cause problems in and of itself. Everyone with COPD should have a pneumonia vaccine and a flu shot every year. I have patients who are convinced they once got flu from a flu shot. This is simply not true. Influenza kills people in this country every year. If you have COPD, you need the flu shot every single year. You might have thought I was going to skip non-traditional tobacco use this time. The truth is, this is so important I saved it for last. Smoking kills people and it causes COPD, and once you have COPD, smoking makes it worse. I know it's easy to say quit smoking, and it's a lot harder to do it. But here's the truth. You need to stop smoking. If you can't do it for you, do it for your grandchildren. Gada abajatumen anishinaabe moen jibamadazima gak anishinaabe ijatwawan. We do these things to keep our language and our culture alive. The only way we'll do that is by keeping our elders with us for as long as possible. I'm Dr. Arnie Vainio, and this is Health Matters.